So for our next session, we're going to focus on HIV and its impact on our community. Please welcome Dr. Maurice Franklin. A pivotal figure in the Black LGBT social justice movement and a former executive staff of the Southern Christian Leadership Conference, SCLC. Y'all remember that? Y'all definitely remember us. Yes, ma'am. Dr. Franklin's contributions to social equity are truly significant. Thank you for your work, sir. Next, we have my sister, Maria Davis, and if anybody ever ate at my restaurant, Soul Cafe, and Maria used to hold down the music, was it on Mondays?
It was Monday night.
I want to say Musical Mondays. What would you call it?
Monday Night Madness.
Monday Night Madness for years and years. Our sister is here to share her story. Come on, Maria, give it up. I love you too. Maria is a music industry veteran turned HIV/AIDS activist and the founder of Can't Be Silenced Incorporated. Our sister is a spokesperson for the National Black Leadership Commission on Health, and her dedication to HIV education has earned her the recognition from the New York State Senate and those sisters that wear red. Was that Delta? Yes. Delta Sigma Theta sorority. Any Deltas in the house? All right, that's like 3 of y'all. Look, I just came back from Martha's Vineyard hanging out with a whole bunch of Deltas. They taking over Inkwell Beach. So joining the discussion next is Erica T. Dickerson. Come on, Erica. Come on, Erica. Let's give Erica that love y'all gave me. Come on. Give Erica the love. Erica is an adult nurse practitioner. I don't know what that means because I assume all nurses are adults, but you're going to explain that. You're going to explain that. She has over 7 years of specialized experience in HIV care at Harlem Hospital ID Clinic, with nursing career spanning 20 years, more than 20 years. She provides comprehensive HIV primary and preventative care, including STI screenings, sexual health counseling, and PrEP services. Erica also contributes to HIV research and co-investigator for a PrEP trial and holds multiple advanced certifications. Go on, girl, come on, come on. Give it, come on, girl. That's a lot of hard work. Our moderator, it's good to see you again. Look at this man smile. Look at, oh, he fine. You know his mama's in the house. I'm telling you, when the grannies come and get you, baby, ain't nothing like it. Elijah Westbrook. Another young man who grew up not very far from here. I heard his story for the first time last year when we did this in New Jersey. And really, really proud of this young man. And let me give you a little bit on him. He's our moderator. He's an Emmy award-winning journalist. Come on. Elijah's career has been marked with significant achievements, including groundbreaking reporting at WBFF, Fox 45 in Baltimore. We're going to talk about that later. Where he unveiled political corruption and earned an Emmy for his coverage of Black Lives Matter protests. Elijah is now a reporter with CBS. He's a Harlem native and the very heart of this event. His presence as our moderator today feels incredibly fitting. Ladies and gentlemen, please give it up for our panel and Mr. Elijah Westbrook. Go on, get him, brother.
Thank you, appreciate it. Thank you.
Yes, sir.
Good afternoon, everyone. Good afternoon. How's everyone doing? Good. I'm loving this energy so far. I know it's been a long day. I hope that you all are learning a lot, soaking in all the knowledge that has been presented to you. As Malik just said, my name is Elijah Westbrook. I'm a news reporter with CBS News New York. I was born and raised right here in Harlem, so today is just truly a special day. Very shortly, we're going to, let me take this microphone off. We're going to embark on a very serious conversation. We're going to have a real talk about something that is impacting our community in such a large way, and that is the HIV/AIDS epidemic. You may know someone who has it. You probably have come in contact with it at some point in your life in a risky situation, or you may have it yourself. But we're about to have a very serious conversation about HIV and AIDS and how it is impacting our community. I had to do a little bit of research, of course, as us journalists do, before getting up here, because I thought I knew a lot about HIV just from hearing it and learning it in school and whatnot. But I was very alarmed about the statistics. And I know you guys on this panel can, talk about that. But just really quickly, the National Office of Minority Health shows that African Americans are nearly 8 times more likely to be diagnosed with HIV compared to white people. The death rate is even higher. So if we break it down by gender, black men are 6 times more likely to die from the disease than white men. Black women are more than 15 times as likely to die from HIV than white women. So y'all, we clearly have a problem. And right now, I want to dive into this discussion. And Maria, I want to start with you because you really have an incredible story. Nearly 30 years ago, back in 1995, you yourself were diagnosed with HIV/AIDS. And you said at the time you didn't know who you contracted it from, but you said it was your fiance. Can you elaborate on that experience and how your life has transcended since?
Well, first I want to let people know I found out through a life insurance policy.
Wow, okay.
And I wanted a $100,000 life insurance policy because I had 2 children. Neither one of them have HIV. And so you had to take a cancer. They did not take care of people with cancer and HIV. So you had to take an HIV test, and I took one. And I took it saying, we don't have HIV, it's a gay white man's disease. And so when the test came back 10 days later, I got it in the mail, the letter in the mail. I'm like remembering all of this. And it said, "Dear Ms. Davis, we're sorry to inform you that you have been rejected for the policy, but you do have HIV, wow, and please go and seek help." So that was in 1995. I didn't know anyone with HIV. Magic Johnson was the only one at the time, and our little sister, rest in peace, Idea. And I read that letter, and I just wrote on it, God has another plan for me. He did have another plan.
That's right. Amen.
But they say when you want God to laugh, tell him your plans. And so getting the stigma was terrible. Because back then they called it, I know everybody remember, the monster. And nobody knew that HIV was the virus that gave you AIDS. So everybody had AIDS. So people didn't want to eat behind you, talk to you. I had a good friend, Deidre Tate. When I did not tell anybody I had HIV, I was in denial. I had a showcase called Mad Wednesdays that was doing very well. And I used to tell my friends, Deidre and them, that I had a bad yeast infection. And they used to say to me, you're 95 pounds. What kind of yeast infection is that? I was like, girl, don't get it. And this, the networking and the connections is what really kept me God first. But finding out information about whatever the doctor has diagnosed you with. So if you have diabetes, find out everything you can, but then find out how you can help yourself. And that is how Dr. Sabi, of course, people giving me great medical information, Deborah Fraser Hauser, the National Black Leadership Commission on AIDS, my family members, Janine and Deidre, and some people in the music industry, but it was a very hard time. But I would not give up, and I did not refuse. So I was diagnosed in 35, and I will be 65 in November.
That's right. Amen. Amen. And Maria, what a wonderful life. And, thank you for, being personable and sharing your story. This leads me to my next question. I want to bring in Dr. Franklin into the conversation. You're someone who has a great deal of insight in terms of how much this virus is impacting us within our community. Can you talk about some of the numbers that I was breaking down to you earlier? And from your experience, just from working within this space, what can we do?
Sure. Sure, and thank you for that comment. So the costs in our community, the economic cost is great. The lack of insurance, healthcare, the impact on productivity, access to education, housing, it impacts every aspect of African Americans. So we talked about sort of this critical race theory, but there's something else called critical healthcare praxis, which talks about the impact of racism, discrimination, white supremacy, and its impact on the systems that impact how we live. The communities that we live in have more, asthma, there's pollution, all these things that impact our health care. And so HIV is no different. Certainly stigma and its impact initially in the disease, and it's still a great big impact. Stigma is associated with so much with how we see the healthcare system, counseling, testing, early intervention, all of those things that perhaps could work in our favor if we had early detection and almost everything that's been talked about today. So it had a great impact on our community. 1 in 2 Black gay men, as the studies and research says that 1 in 2 in their lifetime will become infected and potentially die from HIV and AIDS. The same with the trans community, certainly Black women, or 33%, those are high numbers. And so still in our community.
Yeah, Dr. Franklin,
hello, Jess, can you hear me now? So the impact is great. It's great in our community. And so so programs like this help us to continue to educate and to help decrease stigma, more awareness and community knowledge.
Dr. Franklin, thank you so much for that. And Erica, I want to bring you into the conversation because you especially have a very unique perspective. I know you work at Harlem Hospital and you've treated multiple people with HIV. From your experience, what do people need to know in terms of preventative care and also treatment if they ever encounter HIV?
So the good news is that there are multiple options for treatment, which in the beginning was not true. There were multiple pills having to take multiple times a day.
And if you could
Sure. So the good news is that the treatment has become very simplified. Most people just take 1 tablet a day. Now, more recently, as of the past year or so, we have longer acting drugs, some of them being injectables. So that gives far more options for treatment. We have patients we have patients in their 80s. So patients are living longer lives. Unfortunately, there's still a lot of stigma, which prevents people from getting tested, which prevents people from taking preventive measures. We have 3 HIV drugs that helps to prevent getting HIV. But unfortunately, a lot of the people at risk don't recognize that risk. And we don't take advantage of those medications due to multiple reasons that were already previously mentioned.
Can you talk a little bit about those drugs and what they entail? How
Sure.
often do you have to take them? Because you hear about it a lot, but some people may not know how to effectively take them.
Right. So the HIV treatment options, like I said, most of our patients are taking just 1 pill a day, with or without food. Pretty simple.
That keeps them undetectable.
That keeps them undetectable. So that's the goal, to be undetectable. You will decrease the risk of having HIV-related complications, and you will not spread the virus. So that is huge. We have women who have children, who, although they have been exposed, they are not infected. So that is great news. And they don't spread to partners. So if everyone who was positive was in care and suppressed, and everyone at risk would take the treatment, we would have this disease eliminated. So it is possible. We just have to get more people in care and more people tested. In terms of PrEP, there's 3 drug options. 2 are oral tablets taken every day. There's a second option to take 1 pill on an as-needed basis. And then we also have an injectable, long-acting drug for PrEP as well now, which is given every 2 months.
Okay. And this question, any of you all can answer, but I can only imagine that there's a mental health impact with someone who has been diagnosed with HIV. And I know that we have come a long way when it comes to understanding how this virus works within our body. And maybe, Maria, you can talk a little bit about that. Was there ever a point in your life where you felt like this is it, this is the end, or did you feel like you had hope throughout the years?
Well, because I was diagnosed in '95, we didn't have these kind of conversations. The room wasn't packed like this. So I thought I was going to die. I contracted MAC, Mycobacterium avium complex. I had it not only in my blood, but in my bone marrow. And it was very hard to treat. And I didn't want to get on medication. I was one of them drug holiday people. Oh, I look cute. I don't need to take drugs. I look good. Well, MAC taught me a lesson, and PCP pneumonia taught me a lesson. But my whole mindset of being able to come out, thank God for my friend, 2 girlfriends that was in the book. I was in a book called Souls of My Sisters, and they wanted me to talk about being in the music industry.
Whoa there.
That means I need to call them. They wanted me to talk about being in the music industry, but I shared about living with AIDS and I was going to die. And so I went in the hospital, 1 week stay turned into 6.5 weeks. But I didn't have nobody calling me saying, "You gonna make it," except for my sisters, my sister under me, and my faith family, Canaan, and my faith family, First Corinthian Baptist Church. But I didn't have nobody knocking on my door because I was afraid to tell people I had AIDS, because first they thought you were a hooker, because that's what they said back then, or you use drugs. That was the only 2 ways people thought you can get it. But all you had to do was love and be in a relationship. So that was a whole mental process. I just thank God that I had people in my corner that tell me you are loved, you are special, you are someone. And unfortunately, after COVID, we're not getting those messages anymore. People are all about self. And that's why this talk is very important. And it's not only about HIV and AIDS, it's about, listen, we're struggling out here. We're struggling. And we need to speak life and love into each other each and every day, no matter what you're going through.
So we're 42 years into the epidemic. The first 10 years of this epidemic, there were a lot of people that were dying in isolation and fear. Churches, I think those of us who are old enough remember that history of people's bodies being left at the hospital, having no one to bury them, being buried off on the island, and no matter what city or state that they lived in, we now have access to treatments and early detection and all kinds of tools to help individuals. So we have come a long way, in terms of research, prevention, counseling and testing and training. But the stigma that impacted so many individuals in the early part of this disease, this epidemic, this pandemic that affected our communities, it still permeates in terms of people's ideas, behaviors, the biases, the stigmas. And so while we are grateful for all the treatment that we have in our community, there's still much to do around mental health, the mental health of our community. We're impacted by COVID. We're still dealing with HIV, now we're dealing with COVID. And so all of these things really are connected in the sense of how we as a community deal with community, emotional, social health. Health care includes how we feel about ourselves, how we feel about each other, how we feel our community, where we all show up in support. So we as a community are still suffering from some of those early languages that were created around HIV and AIDS.
You know, and that leads me to my next question about staying politically connected. And I know, Maria, we spoke about this yesterday. You kind of described HIV/AIDS as the forgotten disease, if you will. You said everything is about COVID, 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 and we just kind of forgotten about HIV. How do we stay politically connected with our politicians to get the word out there that this is still a disease that's running rampant and impacting our communities?
So I know and I pray that everybody in here is registered to vote and y'all are committed to vote. Early voting begins October 26th. But the most important thing is that we understand that we do not get money in our community if we don't vote locally. We cannot expect money in our senior citizen centers, HIV. They cut all the HIV prevention, but they just added it back in June. We have U equal U's that was at risk. Listen, undetectable means untransmittable. That's a huge thing that I cannot pass HIV on to somebody else. But if it wasn't for the advocates out there going, you got to go to Albany. We got to get serious now. And this is not trying to beat up on nobody, but if we don't vote, we don't have a voice. If you don't vote, you don't matter. If you don't vote, my next door neighbor child is not going to get what he or she needs. So we have to get out and we have to vote and be political. And listen, don't just stop at you. I'll be on the elevator telling people, you gonna vote? You've been tested for HIV? I don't care. I'm challenging everyone that I see. We have to get involved.
Absolutely. And Erica, from your standpoint, what would you say is the most important thing that everyone in this room right now needs to understand about HIV, treating it, preventing it, from your perspective?
I think everyone should evaluate their own risk. I have seen the gamut. I have seen patients who have had multiple partners, and then I have had patients who've had one lifetime partner. And so everyone should be tested for HIV at least, at a minimum, once in their lifetime. If you are at ongoing risk, you should continue to get tested as needed. That should be also paired with preventive measures. Now, condoms, that's what we preached for many years. Well, we have other tools. Not everyone uses condoms. So we have other tools now. So people should really take advantage. Tell your children, your brothers, your sisters, anyone in your life who could be at risk for this, they should be tested, they should be screened, they should be referred for care as they need to be. So, and what was the second part of your question?
Yeah, no, I just wanted to know from your perspective how important it is that, you know, we walk away today with the right information. And then Maria and Dr. Franklin, you know, you guys can also chip in when it comes to this topic here. But what would you say is something that we need to walk away with today?
So I'm the Vice Chair of Health and Human Services for Community Board 10. So for those of you who live in Harlem, I encourage you to attend our monthly meetings to get engaged locally. We meet the third Monday of every month, and I invite you and welcome you to attend our meetings. The mayor implemented something in February 15th of this year called Healthier Living NYC, which was about increasing the life expectancy of all New Yorkers. Well, what we know, what the data suggests around urban communities, particularly Harlem and the Bronx, and you know those places that have higher disparities around infections and you know all the top 10 diseases that are impacting our community. There's a lack of services and resources in our community, and so your voice at these local meetings, engaging your local, federal elected officials, knowing who your state senator is, your city council person, the advocate, all of these people who we voted in, we expect that they're speaking with our voice. Well, that's not enough. We also need to show up in their offices and let them know what matters to us in our community. So if we want more resources in our community, we have to be engaged and show up every day. And so as we do it, as I do as a member of community board and as the chair of 100 Black Men's Health and Wellness Committee, you know, I speak with the voice of the community. I'm here, but I can only be as strong as everyone else in the room. So your voice equally matters. And so it's important that I hear from you as it is important for our elected officials to hear from you. So we need to be engaged and active every day, not every 4 years, although that's important. It's every day in our community. What do we care about? What's important? It may just be important to you today. Next week, it'll be important to others because your voice, you're speaking it into existence. So HIV and AIDS advocacy, we're still dealing with COVID, the impact of COVID and the mental health in our community. That impacts every other health disparity in our community as well. Because if you're dealing with mental health issues or depressed, then you may not get to the doctor, you might miss an appointment, or you're having, you know, challenges getting to work. All these things impact how we feel about ourselves and how we feel about the community that we live in. So I encourage you to continue to stay engaged.
Yeah.
I want to say something to our seniors. Y'all are having sex. Sorry. And what proves that is the high number of STIs in our community. The nursing homes is out of control. You ain't dead. Grandpa ain't dead neither. So this message ain't only for young people, this is for our seniors too. Some of us have been married, some of us are out of relationships. That cute guy next door who need a couple of dollars, he's starting to carry your groceries for you, I get it. But this message is for you too. So don't think that we're not talking to everybody in this room. Seniors are having sex.
All right.
Very true.
Y'all heard that, huh?
So everybody in the room, I call Maria Davis the mayor of Harlem.
Right.
I call her the mayor of Harlem. Really, I call her the mayor from 125th South, and I'm the mayor of 125th going north. But I have such a great respect for her because of her advocacy in all spaces that she's in. I want to say something. As I was walking this morning, and I did my 5-mile walk run, mostly walk, but when I walked by and I saw all the seniors standing out here waiting to get in at 8 o'clock this morning, I felt so great to see, because what I still know is grandmamas and big mamas, you know, if they're driving the conversations around health care, pushing people to get counseled, tested, or whatever the issue is. It's your advocacy within our community. We need it, we count on it, and we know we can count on you because that's what we do know about our sisters and our mothers is they stand in the gap. And so what I saw is a lot of women, brothers, I love you, but I saw a lot of women this morning standing in the gap. I know you can take this information back into the communities throughout all the zip codes that you come from. So, but we need to continue to push these discussions around uncomfortable conversations. These are uncomfortable conversations that we're having. And of course, everyone in this room is used to having these uncomfortable conversations. And we need to continue to have these conversations.
And going back to Erica, did you want to say something?
Well, I just want to jump on what you said too about being silent. I mean, I think silence is silence is the enemy of treatment and care. And we're all having sex, right? At some point or another. So let's talk about our sexual health. Let's take care of our sexual health. Let's be responsible in whatever way we can, whether that means being tested, whether that means being an advocate for people in our lives, whether it means talking to partners and having honest conversations about how we protect ourselves and each other.
Awesome. Well said. Well said. Let's give our panelists a round of applause. Wonderful job. Wonderful job. I think for now, for timing purposes, we're going to have to leave it at that. But
I
Dr.
just want to
Franklin,
say one
is there
thing.
anything-
For Community Board 10's Health and Human Services Committee meeting for the month of September, we are focused on aging issues. And so we've invited, excuse me, all of the agencies that are providing services to senior population. And so I encourage you to go on our website, the Community Board 10's website, to register and attend that meeting. I think it's September 17th. We meet on 125th Street, but I'd love to see you at our meeting during the month of September. It's next month. Community Board 10. It's Community Board 10.
All right, thank you all so,
Wait a
so
minute, I want
much.
to give
Yep.
a shameless plug. First Corinthian Baptist Church next Saturday on 116th Street is having a big, huge health and wellness fair. Getting all kind of information. Please come out, it's free, and we need to get as much information as we can to prepare ourselves, to prepare our community.
That's this Saturday?
Next Saturday. Thank you all so, so much. And then I think we have about maybe 5 minutes left on this discussion here. If possible, if you guys want to come on up and ask questions directly to our panelists, this would be a great time to do so. Yeah, and we're also going to be staying afterwards as well.
Hi, good afternoon. Maria, I wanted to ask you something, and I'll try my best to get through this. First, you said something about, I wanted to make a comment and piggyback off, yes, the seniors are having sex. And one of the things is when black don't crack, they look real good. They are just as delicious, but a lot of them are not nutritious. That's why you just can't have these hot girl summers. You gotta vet them. You can't go in the bathroom and no, you gotta vet, get that test. Make that your first date. Because you may look delicious, but you may not be nutritious. And guess what? You stuck. So I wanted to get that out of the way. Yes. Check the candy before you put it in your mouth, okay? All right, all right. Not all lollipops have sugar, okay? So, I want to ask you, when you found out about your diagnosis, how did you handle, did you go through an anger or a rage stage? Did you go through an anger or rage stage where you were angry?
Denial, anger, but I was not angry at the man.
Okay.
Because you know what? That was my responsibility to make sure. Love was about me. It wasn't about somebody else.
Okay.
And that's the one biggest take. People ask me, how do you feel about living with AIDS so long? I'm living better. How important I was. And that is the most important thing. Also forgiveness for me. Forgive me that I made the wrong mistake, but the first person that forgave me was God. That's how I got through. And like I said, Canaan Baptist Church and First Corinthian Baptist Church, I'm telling you, I'm not trying to push church on anybody, but your faith is so important in your battle and your fight.
One of my favorite songs is by Mary J. Blige. She said, how can I love someone else when I can't love myself enough to know? And so self-love is so important.
Okay, thank you for that. I'm just going through something where I had to separate from someone that I've known for 30 years. Well, he was my hairstylist, and I just found, I found out that he had the HIV virus, but he's still angry. And he has now turned himself into a weapon where he's purposely having unprotected sex with people out there, and I'm trying to be there for him. I'm comfortable. I used to work for Bailey House, so I am very comfortable in advocating and educating people with that. And I tried to bring him there, he won't go. And he's just purposely out there, he's trying to start fights with people. And the first thing he'll say, I'm gonna bite you. I
So
don't know.
call me. I'll
I wanna
work
give
with you.
my number
Call
because
me,
I
yes.
don't wanna throw him away, he's not garbage. But I'm trying to figure out how to be there for him, but I'm gonna give you my information, thank you.
Hi, good afternoon. Good afternoon. So it's Crystal again. I just wanted to first say that, okay, I just turned 65 in July. Okay, but the majority of sisters that are out here, a lot of you are in your 70s, your 80s, even your 90s. Our black people, we are so beautiful. We are so strong. We are, oh my God, I come into this room and I get chills. The lady up there, she's 80 years old. She got all her teeth and her skin looks so good. We got a lot to celebrate. And you know what? We're going to do better in our neighborhoods. Because if I got to scrub my floor in my house to keep disease out of my house, that means my streets got to be clean as well. So our governor, our mayor, our city council, and whoever else we got to deal with, we're going to get in their face. That's number one. The thing about AIDS that I was concerned about was that drug called non-detection. When I first saw the commercial on TV, I was a little confused. I said, because if I lay down or if I meet a man and I like him and all this kind of thing here, and he has the AIDS, but it's non-detectable, and I'm thinking, oh, well, he don't have it, and I lay with him unprotected. So the terminology non-detectable, can you clarify that? Where did it come from?
So they did a study probably 10, 15 years ago now, probably 15 years ago, and they studied couples, thousands of couples, where one partner was positive and one partner was negative. And when the partner who was positive took the medication and remained undetectable, they did not transmit the virus to their partner. So you have to make sure that your partner, though, is undetectable, because people say that, but if they're not taking their medications consistently, then all bets are off. So PrEP and condoms are also there so that if the negative partner wants to protect themselves as well, those options are available to you.
Hello?
Okay, so we have time.
Hi, my name is Kristen Covington, and I'm a woman who's been living with HIV and AIDS since 1987. I was 22 when I got diagnosed. I didn't know what it was about. I just paid it no mind. I got sick in 2005, but today, God has a plan for me. I'm going on 59 years old in December, you know? AIDS ain't no death sentence. Let me tell you something. It's no death sentence, okay? AIDS didn't make me. You understand? I made it. But I'm great with it. God had a plan for me. I didn't think I would be here today. And that was always a shame. This is my first time ever saying to anyone, yes, I am HIV positive / AIDS, whatever. And that's how it goes. That's all I wanted to say. Thank you.
We have time for one more question. One more question.
That's my family.
Hi, good afternoon. I'm Patricia McNeil Shelton. I'm 71 years old. I was diagnosed in 1992, and I've been undetectable since 1992. I'm also a peer educator and a speaker, and I always said the only thing that bothers me is my in-laws. I have no health issues other than high blood pressure. I think I'm getting rid of menopause, but I just want to say thank you to Marie. She's always been a bit activist. She's always been a little sister to me, and I'm praying and hoping and my fingers are crossed, and you know what I'm talking about. But thank you for being out there for those who can't be out there. And if you ever need help, you got a bunch of sisters sitting right behind me that'll help you.
Thank you so much. All right, well, I think that's all the time we have. Could we sneak one more question in, Deidre? We have one more person. Okay, here you go.
Okay, so thank you, Marie, for coming. FCBC in the house. My name is Ruby Garner. I was diagnosed with HIV in 1999. I got it from my husband, who I was madly in love with, but he neglected to tell me that he was bisexual. At that particular time, I was just like everybody else. What? Monster HIV? That's not in my neighborhood. That's not for me. But the fact is that I became HIV positive, and of course, like yourself, I was in denial. I thought I was going to die, but God had another plan for me. So my doctor advised me start taking medication. I've been taking medication every day, all day, the same time, every day. All right. I'm so grateful to God because He gave me a reason. I am also a HIV advocate professional. I'm a state professional. I also am proud to say that of all the things that I've done, that I'm still doing, my biggest pride is being able to go and teach adolescents in the probation offices about HIV and about being who they are. My greatest asset are my two children. My daughter, she just got her double master's with honors from Iona College. They grew up with me while I grew up with with my HIV. I can't say about anybody else's, but it was my HIV, right? And now I'm proud to say I'm HIV positive. I'm 70 years old. I zip line, I zip line, I parasail, and I ride horses, I go on cruises, I'm living my best life. So this is the lesson that I give each time that I do motivational interviewing for any of my people that need to hear it, especially in the South Bronx. Thank you.
Thank you so much for that.
I want to shout out all my HIV sisters up in here. God bless you, and we living.